Hello everyone, and welcome to this webinar on COVID-19 and breastfeeding, hosted by Breastfeeding Promotion Network of India, BPNI. I can see we are quickly being joined by 194 participants as of now, and so we are right on time, and we can go ahead. So my name is Abhilasha Rawat. I am Director Training for Breastfeeding Promotion Network of India, and I will be your moderator for today. I'm really excited to have so many of you joining us today as we are quickly moving ahead. I would want to tell you a little bit about BPNI. The Breastfeeding Promotion Network of India was founded on 3rd December 1991 at Wardha, Maharashtra. It is a national network of organizations and individuals dedicated to promote mother and child health through protection, promotion, and support. Among other works undertaken by VPNI, IMS Act monitoring, capacity building, advocacy, networking, WBTI, and WBCI are some of its international and national work. All of our viewers can visit our website at www.bpni.org to know more about us and our work, and you can also find a lot of resource material that you may use. BPNI has always been committed to support and promote breastfeeding, so it is of prime importance for us to disseminate correct information regarding breastfeeding, especially during this global pandemic. So this webinar will surely help our attendee clarity on this subject. Now I would like to welcome all the panelists. I feel honored by the presence of all our esteemed panelists who are experts on breastfeeding and infant feeding, and we're looking forward to listening to them. I would quickly share today's agenda for this webinar. We will start with Patty Rundle. She will share what is the global guidance on COVID-19 and breastfeeding. This will be followed by Dr. JP Dadich, who will be talking about evidence and practices on how to support mothers to breastfeed during this COVID-19 pandemic. This will be followed by Dr. Padmini Angela De Silva. She will be talking about WHO Sierra's initiatives on infant feeding during COVID-19. And this will be followed by Dr. Gayatri. She will tell us about UNICEF's initiatives to protect and promote breastfeeding during COVID-19. Next, we will have Dr. Ajay Kiram. He will share his expert views on infant feeding during COVID-19. And this will be followed by Dr. Arun's presentation, and he will talk about exploitation of COVID-19 pandemic by the baby food companies. Followed by this, we will be having a question and answer sessions. I would like to request all the panelists to stick to the time limit of 10 minutes for a successful flow of this webinar. So now, before I hand over the screen to our first speaker, that's Patty Rundle, I'd like to tell you a little about her. She is based in UK and has worked with IPFAN, that's International Baby Food Action Network, since 1980. She has helped strengthen laws, WHO resolutions, and codex standards. Conflicts of interest is central to her work, and also building networks such as Baby Feeding Law Group, Conflict of Interest Coalition. She has led the Nestle boycott for many years, and she's also a member of Infant Feeding in Emergencies Group. Today, she will share with us global guidance on breastfeeding in COVID-19. I will now mute my microphone, and I'd request rest of the speakers to do the same. Over to you, Ms. Patty.
Thank you very much. Now I need to share my screen and hope that, yes, and I need to do this share screen, share, and make sure that it comes up. Hold on, I'm just going to share the screen. Good morning, everybody. Hello, it's very, very nice. This is the first webinar that I've done like this. I've joined many, but I haven't actually shared my screen before. So welcome to everybody. I'm just going to briefly go through the global guidance. Now, how come that went like that in like a, okay, that was very beautiful. IPFAN as BPNI is part of IPFAN, the International Baby Food Action Network, founded in '79, and it's now 273 groups in over 160 countries. Now, key to our work is independence, and IPFAN members, and remember, are not allowed to take funding from the baby food industry. And conflicts of interest are at the heart of what we do, and the promotion of the international code and all the resolutions. I think I do the next slide. Now, what we need, IPFAN has always worked alongside WHO and UNICEF from the very beginning. This is one of the things that has been absolutely central to our work, is to have a global view on global health and to make sure that the UN was speaking with one consistent voice. So we've been over these 40 years and more than 40 years, you know, trying to make the world understand that we are not just sitting there in our isolated rooms and cities or wherever. We need to, this is a problem. The attack on breastfeeding has been a problem from global corporations mostly, and from other aspects. It's not only marketing that's the problem, but it's a major cause of problems. So here, sorry, I need to go back again. I'm going to go through the WHO and the UNICEF guidance, just very briefly, because they're the ones that have really taken the lead here on giving guidance. And it's very, very important that they have unequivocally recommended breastfeeding, skin to skin, including for COVID infected mothers. So here, sorry, my thing has come over there. You have from the very beginning, even though we didn't know, and it's been very, very short time that we've been aware of the COVID problem, WHO and UNICEF both put out rather good messaging, and it steadily got stronger. So we have from the 7th of May, a frequently asked questions. That's a later question, but it is actually very, very good and very, very clear. And you've had all sorts of other ones as well. So I'll go to this one first. So on the WHO question and answer of the 7th of May, you have very clear questions. Can COVID-19 be passed through breastfeeding? Transmission of active COVID-19 through breast milk and breastfeeding has not been detected to date. There is no reason to stop or avoid breastfeeding. Then your question, following delivery, should a baby be placed skin to skin? Yes, says WHO, immediate and continued skin to skin care, including kangaroo care, improves the temperature control of newborns and is associated with improved survival amongst newborns. Placing newborns close to mother also enables an early initiation of breastfeeding. So it's really brave of WHO and good that they have said this. Can women with confirmed or suspected COVID breastfeed? Yes, women with confirmed or suspected COVID can breastfeed. This is excellent that they are saying this, but they are, of course, putting out warnings about soap and water and actually washing hands, wearing a medical mask, sneezing, and all the rest. Now, one thing I'd like to say here is that WHO and UNICEF are the sort of, they can gather in information from all over the world. Those of us who are breastfeeding advocates, you could say that, actually, like BPNI or any of the IPFAN groups or any of the other mother support groups, you can imagine that certain people will not trust what we have to say because they'll say you're biased. And to a certain extent, that's very true, is that one is looking for things that support your case. That is inevitable that will happen. But when you've got, and that's why you need a body like WHO and UNICEF who can stand back and say, look, we have to be trusted, we have to be trustworthy. And it could be that it isn't the right thing to breastfeed. And certainly those of us who went through the HIV, everybody I think here was around when the HIV crisis happened and was so disastrously managed to begin with no support with the, for the mothers to breastfeed, and lots of mothers there was replacement feeding, and many babies died because the immediate problem was considered the transmission of the virus from the mother to the baby. And so when mothers were not given antiretrovirals, and that's a highly political point, the babies were just put on replacement feeding. So these sort of things are very important, that the public can trust that the advice they're given is absolutely uninfluenced by any commercial or other concerns. Now, of course, the advice is also based on the available knowledge, and at the moment we're in very early days. But at the moment, what WHO and UNICEF are rightly saying is there is no evidence around that breastfeeding is the problem and is the root of transmission. That yes, you may have some fragments of the virus in breast milk, but actually it's more likely that the baby will get all the antibodies, and the rest of the speakers will speak about that. So we're very pleased that WHO and UNICEF have both done that, and UNICEF has done a whole series of guidance. Some of them are not as clear as WHO's are now, but they are also doing guidance on maternal diets, and also guides for local authorities and all sorts. So UNICEF has done a whole series of guidances that are very good. So we can clearly say, follow WHO and UNICEF guidance. This one here is the one in the UK, and it really goes on very nicely. It even deals with artificial feeding if people want to do that. It's very good guidance. UNICEF also tackles exploitation, which is really interesting. And it's actually looking at its own financial, how should it take financial contributions in kind? Because many organizations take money from all sorts of companies. And I think in the COVID situation, UNICEF has really tightened up its rules. And I'm really grateful for that, because this is a very important time when we're trying to make sure that mothers, well, all families get good, wholesome food and are not immediately, and Aaron will talk about that later, but sort of the ultra processed foods, the baby food companies and the junk food companies are all desperate to try and make sure that we think of them as the first thing. CDC, I want to briefly talk about CDC. US Center for Disease Control. It has two guidances, and all of them are really problematic, and they recommend separation of mothers and babies, actually up to 6 feet apart, if the mother's got known or thought to have COVID. So this is a real problem, because CDC are all throughout Latin America and elsewhere, and I understand they've even influenced the guidance for management, the Indian guidance. So here you have them saying the recommendations are adapted and based on guidance from CDC. Also, the American Academy of Pediatrics, hugely influential, and that is actually saying, again, the 6 feet, keep your babies 6 feet away if there's any doubt that the mother's got that. But then you look at CDC, American Academy of Pediatrics, and you'll see the partners that it has. It partners with the very companies that we find problematic. So there you have Nestle, Mead Johnson, Abbott, all these major things. This is really problematic that has fallen into that. And about the time, This is mirrored by the Danone setting itself up as expert advice in Indian mothers. And thank you to BP&I for spotting this. Again, mother should wear a mask, mother should be 6 feet away from her baby. So this is a really problematic thing. Thank heavens we, following BP&I's exposure and ours exposure, they've taken it down. But here, Indonesia, separating mothers and babies. So this is a really sad story showing you how difficult it is for mothers when they're separated from their babies routinely. And then here are a few more examples from Pakistan. This is, and the company's pulling up, you know, these are webinars that they're doing that are all against the code. I don't know whether I'm out of time nearly. This is this is in Mexico, this one here, an advert showing the industry, showing either the coronavirus, the virus there, and saying that the problem, if you look at the video that is on there, you'll see that they're recommending this formula as a protection. Extraordinary. Then the last thing I'd like to is the Bill Gates. A lot of us we're aware that Bill Gates has put a huge amount of money into WHO. It's probably 16% of the budget now, and really problematic. Some of the things are excellent and good on breastfeeding, but in others they're not. And here now we find today or a few days ago, Bill Gates doing investment in a lab-produced breast milk. This is really worrisome, and we should be very, very concerned about this. So I'll finish very quickly on the fear of transmission is a really, really problematic thing. That if we concentrate too much on whether there are bits of the virus in the breast milk, we are opening that door for the companies to say our formula is much, much better and safer. So we have to be really, really careful here. We don't want to revisit the situation of the 70s where the companies were teaching mothers how to breastfeed. So thank you very much. I think that I'll stop there. That's probably 10 minutes, is it? Okay.
Thank you, Ms. Patty. Thank you for sharing global guidance on breastfeeding in COVID times. I would request rest of our panelists to please stick to time. We would not like to interrupt you in between. You have 10 minutes each. Please try to stick to the time. To all the new attendees who are joining us, I would like to tell you again, right now we have 401 participants, that any of your questions will be taken at the end in the Q&A session. Next, I would like to invite our speaker, Dr. J.P. Dadich. He's Director Technical BP&I India. He is MD Pediatrics, Fellow at National Neonatology Forum. He has been an integral part of BP&I since more than 1.5 decades now. He is a co-chair of the Global Council of International Baby Food Action Network. He has several publications in peer-reviewed journals and has contributed to several guidelines and chapters on breastfeeding and infant and young child feeding. And today he will talk about how should we support mothers to breastfeed during COVID-19. Over to you, Dr. JP, sir. You have 10 minutes.
Thank you, Abhilasha. Let me, yeah. So my screen is visible to you? Yeah, okay. Thank you. Good afternoon, friends. When we talk about standard global recommendations on breastfeeding, they include initiating breastfeeding within 1 hour of birth, exclusive breastfeeding for 6 months, and continued breastfeeding for 2 years and beyond, along with appropriate complementary feeding after 6 months of age. Should COVID-19 suspected or confirmed mothers follow these recommendations, keeping in view the apprehension of transmitting the disease to the infant through breast milk? In my presentation, I will try to answer this question with the help of available scientific evidence and recommendations by WHO and UNICEF, which are practically in favor of breastfeeding. I will also discuss with you why practicing breastfeeding during the COVID-19 pandemic is important, what precautions the mother should take to make the process safe for the infant, and how she should be supported in this task. First, why breastfeeding during the COVID-19 pandemic is important. This is an established fact that breastfeeding prevents morbidity and death in neonatal period, infancy, and childhood. In India alone, it can prevent 100,000 childhood deaths each year. One of the important factors helping to achieve this is the protection provided by breastfeeding against infections. This is mediated through direct transfer in the breast milk of several anti-microbial and bioactive components like immunoglobulins, cytokines, and anti-inflammatory factors, cellular factors like T and B-lymphocytes, neutrophils and macrophages, and human milk oligosaccharides. The graphic shows the special way in which breastfeeding protects a baby against new infections which baby's mother may have. When mother becomes infected, her body makes antibodies against the infection to protect her. These antibodies are secreted in her breast milk to protect the baby. Therefore, a baby should not be separated from the mother when she has an infection, because her breast milk provides protection against the infection. Interestingly, when we are talking about infant feeding during the COVID-19 pandemic, recently, rather yesterday only, a preprint study from USA has reported strong secretory IgA dominant COVID-19 virus immune response in human milk after infection in the mother. This is significant finding, and I will discuss about it in my subsequent slides. Now we come to the question of transmission of COVID-19 virus through breast milk. So far, the available evidence suggests that replication competent active COVID-19 virus has not been detected in the breast milk of COVID-19 suspected or confirmed mothers. And there are several studies about this. There are some case reports from Germany, Australia, and Italy about presence of detectable COVID-19 virus fragments in the form of viral RNA in the breast milk of COVID-19 positive mothers. On the other hand, many other studies, some are given here, published during last few months have reported absence of COVID-19 virus in the breast milk. So in summary, so far, there is no report of active COVID-19 virus, means virus that can cause infection in the breast milk of mothers with confirmed or suspected COVID-19. On the other hand, reports are emerging which suggest presence of secretory IgA against COVID-19 in the breast milk of mothers with COVID-19. What are the recommendations of global agencies like WHO and UNICEF on infant feeding by COVID-19 suspected or confirmed mothers? So Patty has already talked about these recommendations in a little bit detail. In short, we can say that these agencies, they are saying that infants born to mothers with suspected, probable, or confirmed COVID-19 infection should be fed according to standard infant feeding guidelines while applying necessary precautions for infection protection and control, that is IPC. They also recommend keeping the mother and baby together. So what should be the advice to COVID-19 suspected or confirmed mothers? In view of the available evidence and recommendations from WHO and UNICEF, this is prudent to advise mothers suspected or confirmed with COVID-19 to practice breastfeeding with appropriate precautions to prevent infection through respiratory droplets. They should be counseled and provided skilled support by a trained person during pregnancy and at birth to practice skin-to-skin contact, initiation of breastfeeding within 1 hour of birth, and later rooming in and exclusive breastfeeding. Avoiding separation and keeping mother and baby together helps in better temperature control in the babies and initiating and establishing breastfeeding. It also helps in reducing stress in the mothers. To minimize the risk of infection through respiratory droplets, mothers should practice appropriate infection prevention and control measures, details of which I will tell you in a later slide. Institutions Institutions should develop and communicate the standard operating procedures for breastfeeding by COVID-19 suspected or confirmed mothers to all caregivers, mothers, and families. COVID-19 suspected or confirmed mothers having infants below the age of 6 months should practice exclusive breastfeeding. Mothers with infants and young children above the age of 6 months up to 2 years of age beyond should continue breastfeeding along with appropriate, adequate, nutritious complementary foods. While breastfeeding, mothers should practice appropriate IPC measures. She should be appropriately supported to practice these measures. All mothers should receive IPC counseling and skilled support by a trained person. In case the mother is sick and unable to breastfeed or separated from the baby for ICU care, her expressed breast milk remains the preferred choice. A healthy caregiver can feed the expressed breast milk to the baby with a clean cup or spoon. Apart from providing all the benefits inherent to breast milk, expression also helps in maintaining the milk supply. Not able to express a milk due to sickness, donor human milk, depending on availability, can be another option. Wet nursing may be done depending on acceptability and availability and after ruling out the risk of HIV. If nothing works, then a breast milk substitute or animal milk may be given to the infant depending on the availability and acceptance. Finally, all mothers should be supported to start breastfeeding once she recovers and feels well. Now, a few words about the IPC measures. COVID-19 suspected or confirmed mothers should practice appropriate infection prevention and control measures to prevent transmission of infection to the infants through respiratory droplets. These include frequently washing hands with soap and water or using alcohol-based hand rub, especially before touching the baby, wearing a medical mask. If medical mask is not available, breastfeeding should continue. Observing respiratory hygiene by coughing or sneezing, disposing it in a closed bin, and washing hands with soap and water or using alcohol-based hand rub after doing this, and regular cleaning of frequently touched surfaces. Mothers should receive logistic help to procure the appropriate items for IPC like masks, water and soap, alcohol, hand rub, etc. to practice respiratory hygiene in the health facility and at home. She should also be given practical instructions through demonstrations and audiovisual tools to practice these measures. So these are the key messages for the caregivers and mothers both. COVID-19 virus is not transmitted in breast milk. All mothers, irrespective of their COVID-19 status, should be supported to practice optimal breastfeeding. COVID-19 suspected or confirmed mother and her baby should not be separated unless required due to sickness. COVID-19 suspected or confirmed mother should observe appropriate IPC measures. And if mother is too sick to breastfeed, are expressed breast milk followed by donor human milk. So this is all I wanted to share with you. I stop here. Thanks for your kind.
Thank you, Dr. JP, for your presentation. Now I'd like to request all the panelists to please officially launch the infographics and information sheet from your screens. You can show the printout or your from your tablet or mobile screens for this official launch.
I'm trying. It's not working actually.
Can we all do this? The official launch?
But the screen is not shared. Just a minute. Yeah. What we can do. Yeah.
Can the host take a screenshot of this?
Not easy.
Yeah. Dr. Gayatri, can you please, we can't see your screen.
Yes.
Yes, now we can see. Dr. Arun, can you please do that again?
I'll again, but it seems it's not working. Anyway, go without me because it's not working on my screen. Yeah.
It's okay, sir. It's okay.
Yes.
Thank you. I would again request all our panelists to please stick to the time limit. Next, I am calling our next panelist. She is an MBBS and PhD, Dr. Padmini Angela De Silva. She is a public health nutrition specialist with over 20 years of experience. Dr. De Silva is the Regional Advisor, Nutrition and Health for Development, Department of Non-Communicable Diseases and Environment Health at World Health Organization's Regional Office for Southeast Asia. In the past 5 years, Dr. De Silva has focused on addressing double burden of malnutrition, that is undernutrition, including micronutrient deficiencies and overweight and obesity, with its antecedent risk of non-communicable diseases across 11 countries of Southeast Asia region. She will share with us today the WHO CRO initiatives on infant feeding during COVID-19. I will now mute my microphone and request all of the rest of the speakers to do the same. Over to you, Dr. Padmini. You have 10 minutes. Thank you.
Thank you, Abhilasha, and good afternoon, everybody. Can you hear me? Yeah. So in the next 10 minutes, what I will do is I will discuss some of the initiatives that are being taken by WHO Southeast Asia region, which includes the regional office as well as at country level, to promote and support infant feeding through the propagation of our guidelines and support to implement some of the guidelines that we have been producing. So all of you are familiar with Southeast Asia region of WHO. It spans from Bhutan, Nepal, India, Maldives, Sri Lanka, right up to Timor-Leste in East Asia. And in these countries, there has been some disruption to healthcare delivery, different degrees of disruption because of the fear, misinformation, and limitations on movement. Therefore, infant feeding has been affected, though we do not know to what degree because we do not have the evidence. But anecdotal evidence shows that there has been some issues with infant feeding support. Now, the work that we do across the region on infant feeding is not just done by our nutrition division or nutrition unit, but also we work together with our maternal and child health colleagues at the regional office. Then we work with our country colleagues, the focal persons for nutrition, maternal and child health and health systems, as well as the health emergencies team, who all work together to try and promote health service delivery, which also includes infant feeding support. So there are three main action areas in which we work, or how we work. One is advocacy and communication. Everyone is familiar with the WHO evidence-based guidance that was previously referred to by both Patty and by Dr. Dadich. And we advocate with governments, and we also communicate with the general public. We disseminate the WHO evidence-based norms and guidance. The information we disseminate to ministries, development partners, and stakeholders. And then thirdly, we also support to implement current recommendations on infant feeding across the health system of these 11 countries. I will not go into details because Dr. Dadich and Patty both went into details that shows that WHO clearly recommends that mothers either suspected or confirmed with COVID-19 should not be separated from their infants and they should breastfeed. The key recommendation is this, and this is based on several factors. One, of course, is the evidence, and the other is the fact that on a risk-benefit analysis, it shows that the threat of not breastfeeding is much more severe than the possibility of a mild infection which a child can catch from a mother, which is also not very clear at the moment. And now the WHO recommendations on infant feeding were shown by Dr. Dadich, and this clinical management of COVID-19, which is the interim guidance, the latest guidance came out in 27th May. I will only just refer to the two sections of it. One section very clearly describes mother and infant contact birth. about not being separated, skin-to-skin contact, breast within the first hour, and kangaroo mother care. The second part of the guidance is on the practices that facilities should follow for breastfeeding. So every health facility should be which provides maternal and should enable a mother to breastfeed. They should be given practical support to enable them to initiate and establish breastfeeding, as long as to manage common difficulties. And there shouldn't be any promotion of breastfeeding, breast milk substitutes, feeding bottles, and so on. And if the mother is too unwell to breastfeed, they must, the facility should support in exploring alternatives for young children, newborns, and infants. Now, if I go into a little more detail about how we actually communicate and advocate across countries, we ensure breastfeeding promotion and support as an essential component of or essential service delivery during the emergency period. During this time, there was prioritization of health service activities. So we have been advocating to include breast promotion and support as part of this essential service delivery. We work with governments, we work with professional associations, we work with the technical advisory, WHO technical advisory group members and other key stakeholders to try and promote this message. The second way we communicate is through media communications, through various multiple channels, targeting the general population to promote breastfeeding, clarify and counteract conflicting and misleading information, and to encourage utilization of essential health services. Then we also provide technical support for breastfeeding service delivery. WHO has come out with two main guidance documents, one jointly with UNICEF and IPC, which clearly describes the community-based healthcare, including outreach healthcare, which would infant feeding as well as all other forms of healthcare delivery. And document is on maintaining essential health services and the operational guidance, which came out on the 1st of June. This is the second round of document. So in community settings, what we promote is that governments support development of country operational guidelines and implementation of ANC services, which include antenatal and postnatal pregnancy counseling at clinics as well as in the community part. And we also support through various tools to enhance workforce capacity, to monitor examples of how digital platforms work, home visits all the time by keeping IPC measures in place, and also sharing of good practices and of identifying monitoring indicators to monitor community service delivery. We also work at facility level to support breastfeeding, promote, protect, and support breastfeeding in health facilities. I won't go into the list of activities that has to be done at the facility, but two other points I want to add is management of illness in severely ill children, including feeding, and also if necessary, excuse me, on relactation support. So we provide technical guidance, we provide implementation support, guidance or technical guidance for implementation and service delivery within institutions. I just want to highlight one of the very clear messages that in the question and answer document that was being referred to, there's a very clear decision tree. This shows in the community or at a healthcare institution how breastfeeding can be supported. So this is just one example of the very clear messaging that we have been providing. Finally, we also undertake various joint actions with development partners like UNICEF and other stakeholders through issuing of statements, information dissemination sessions, and advocacy, and also support the promoting of implementation and monitoring of the code of marketing of breast milk substitutes, and we support in identifying and also rectifying violations whenever possible. Thank you.
Thank you, Dr. Padmini, for this information. Moving on, I would invite our fourth speaker for this webinar, Dr. Gayatri Singh. I hope she has joined us. Is she here? let's wait for her until she comes. Let me tell you a little bit about her. She is a professional in the field of public health nutrition and holds a PhD degree in nutrition. She is currently working as a child development specialist at UNICEF, New Delhi. In UNICEF, she leads the work on infant and young child feeding. She has worked extensively with national and state governments, academic institutions, and with NGO partners in designing, implementing, and managing large-scale programs for early childhood development and nutrition. Today, she will be talking about initiatives taken by UNICEF India to protect, promote, and support breastfeeding during COVID-19. Have we reached Dr. Gayatri?
I think her internet connection is troubling. Maybe we move to the next speaker before she joins. So,
Sure.
yeah.
Sure.
We don't stay connected at this moment. Yeah.
Okay, we will wait for you, Dr. Gayatri. Until that time, we can go ahead with our next panelist, Dr. Ajay Kiram. He is a former commissioner with the Ministry of Health and Family Welfare, Government of India. He is a medical graduate with postgraduate qualification in public health with more than 25 years of experience in public health program management at national level. He has headed many national programs like Mother and Child Health Program, National AIDS Control Organization, and National Integrated Disease Surveillance Program. He has an experience of teaching field epidemiology at National Institute of Communicable Disease, New Delhi. He has also worked internationally as an epidemiologist in Sultanate of Oman and WHO consultant in Myanmar, and has investigated a number of outbreaks of communicable diseases and published more than 50 articles in national and international journals. He is also a member of various technical bodies of Ministry of Health and Family Welfare, ICMR, WHO, UNICEF, UNAIDS. Today, he will share with us his expert views on infant feeding during COVID-19. Over to you, Dr. Ajay Kiram.
He's muted. Ajay, you are muted.
Yeah, I'm sorry. Yeah. Very good afternoon to all of you. And first of all, thank you very much for inviting me to be part of the panel discussion around breastfeeding and COVID-19. Now, as you know that, the world is facing a very unprecedented situation of COVID, where there is a threat to the life of many people. And this COVID pandemic is affecting the whole of the world, large chunk of population, and even the pregnant women and the small children are also not spared. So this is a big pandemic which is happening across. Beside this problem of this COVID pandemic, we are also aware that regular health services are also getting impacted. And it is quite obvious. But looking at the length of the pandemic and the way the pandemic is moving across the globe, and we are also worried about these regular health services which are getting impacted, the government of India recently declared few services as essential services, because they can't wait. One has to act upon, one has to continue to invest, but maybe our strategic approach might have to be modified in this COVID environment. But whatever it is, the government of India has declared RMNCH services, beside other services, as essential services. And this has been done in consultation with WHO, in consultation with the UNICEF, and various other partner organizations. This is a kind of unanimously it has been decided. And when we talk about essential services in the context of RMNCH, our context is that we really want to improve the health of the mother and children. We want to address the survival of both mother and children, not only survive, we also want that they should also thrive well. And you are all aware that we have large commitments in terms of sustainable development goals. Keeping those sustainable development goals commitment in mind, simultaneously the government of India's declaration as RMNCH services as essential services. I consider, breastfeeding as one of the powerful intervention within that umbrella of the RMNCH. I'm not going to talk about the RMNCH broadly because it encompasses variety of interventions. But to my understanding, this is promoting breastfeeding is one of the most powerful intervention. And if I talk about the role of breastfeeding in terms of survival, this is one intervention which can reduce the neonatal mortality by 20%. There is no other intervention, which can reduce child neonatal mortality by 20%. It is such a powerful intervention, breastfeeding, which is an integral part of the RMNCH services. And this is an intervention which not only helps in survival of the newborn, survival of the mother, which is one of our commitment and the priority. It also addresses, issues like, undernutrition. Undernutrition is again such a huge problem in India. And if we don't address breastfeeding appropriately, we'll be failing in our goals of undernutrition. We will be failing in our goals, which we have committed in our big program, which is called as the Poshan Abhiyan or National Nutrition Mission. And beside this, we are also committed to not only survival, India is also committed to overall development of a child, overall development, child development. So this is one intervention which not only helps in survival, not only helps in overall development of a child, but also in terms of, the overall, development of a child, survival, and addressing the undernutrition. And beside that, there are so many collateral benefits. I'm using this opportunity of, talking about the power of the breastfeeding. Then I'll talk about in the context of, COVID. And it also has an implication in terms of, the future occurrence of non-communicable diseases or future occurrence of cancers. It has multiple benefits. Now, you are all aware that in the last, last decade, I will call that, in India, we have been able to make I will call it a significant progress. But significant progress, what I'm saying is that maybe a decade back, our early initiation of breastfeeding, which is the breastfeeding within 1 hour, was 24%. And then we have been able to improve it to 42%, as per the NFHS 4 data. But 42% is not enough because against the backdrop of 80% institutional delivery. But whatever it is, we have been able to make a significant progress in terms of early initiation of breastfeeding. We have been able to make a dent in exclusive breastfeeding improvement, more than 50%. And similarly is the case with the complementary feeding. But there is a real threat during this COVID pandemic, where people are not availing regular health facilities. People are not paying attention to this so-called the powerful intervention. So there is a threat that whatever gains we have made in the last decade, they'll be lost. So it's a real threat. So we as, kind of the breastfeeding, kind of a promotion community, we must make sure that everybody understands the power and the potential of the intervention. And there is a possibility of impacting whatever gains, we have been able to achieve. Now, whenever we talk about, COVID in the context of breastfeeding, so, there are three I will continue to call if you really want to improve breastfeeding rates. There are three approaches which has to be put in place and which has everybody referred to. But just to put it in the context that one is obviously we need to promote by increasing knowledge of the mothers, promoting by increasing the knowledge of the healthcare providers, that how powerful this intervention is. That means we need to promote this breastfeeding. We need to utilize every opportunity. And I think COVID-19 is another opportunity that we need to talk about this power of this intervention. That's promotion. And then the second point is, the support to the mother. Because generally people think, the healthcare providers or even the policymakers generally think that, breastfeeding is a normal physiological phenomena. Why you want to waste time? Why you waste energy in, promoting breastfeeding? It will happen automatically. But to be very frank, the reality is that early initiation is 42% after so much of efforts. So unless the mothers are supported at the point of maybe immediately after delivery or during antenatal period, so I think support to the mother is most critical part. And support is required obviously through the family members, through the ASHA workers, the community health workers. So a lot of interpersonal communication is required. And I know that in this COVID environment, we are following the golden principle of social distancing. Maybe our health workers will not be in a position to support the mother from that point of view. But in terms of they can all use new techniques of maybe kind of telecounseling approaches. So we must appropriately use available the digital platforms, electronic platforms, in terms of supporting the mother. Unless the mothers are supported, there is a high chance that we may fail in our targets, which will ultimately impact the survival, growth, and development of children. So that is support is critical in this COVID environment, and we must find out these opportunities and the mechanism. And one of the mechanisms which I referred to was the kind of a telecounseling. And then the third important thing, which is generally there is a high possibility of getting impacted in this kind of an environment where there is a COVID environment, number of philanthropic organizations, number of donors, everybody is willing to help the health system, and their intention may be very good, but sometimes are donating the infant milk substitutes. They think we are serving the community, we want to help the community. And that's why I say the third important piece is the protecting breastfeeding. And there is a high possibility that during this COVID environment, the so-called the protection of breastfeeding can get highly impacted. And we have seen across the globe number of examples. Within India, I have seen so many photographs which Dr. Arun Gupta keeps sharing. People find that they are distributing breast milk substitutes. They might be doing good things, but in reality they are impacting breastfeeding. So we as the stakeholders of breastfeeding, we must make sure that these kind of products are not promoted, because this will have a not only impact immediate in the short term, even in the long term it will have impact on the breastfeeding. And India has been able to maintain those global nutrition target of around 50% breastfeeding. We have been able to maintain. There are some countries where the breastfeeding rates are going down like anything, 10%, 20%, but we have been able to maintain this. Maybe this COVID environment should not make our breastfeeding rates go down. So we have to be very cautious of these facts, which I thought of sharing with you. And last but not the least, because as on today, we do not have any evidence that the breast milk contains, transmits COVID virus. There is one study which Dr. Dadrit was quoting, that was only the dead virus or a dead genome was there. But there are limited, as per today's evidence, as per available evidence, breastfeeding appears to be a very safe option. And obviously, in a medical science, we always keep on revising the evidence, and we always do any action by making a risk-benefit analysis. And as on today's available evidence, the benefit of breastfeeding is many times higher than maybe the smallest risk which happens. And then the second important point which is being talked about in the context of breastfeeding is, it is also the rooming in. Mother wants to be together, and mother and newborns can be together, but using simple preventive measures like regular hand washing, and while breastfeeding the child, use a simple mask. I think these simple techniques can really help in taking care of the threat of the COVID, and it will also help in promoting breastfeeding, so that we should be able to maintain whatever gains we have been able to make in the last decade. So with these few words, I stop here. Thanks for inviting me on this panel. Thank you.
Thank you, Dr. Khera, for your expert views. Do we have Dr. Gayatri Singh now with us?
Yes, fingers crossed that the network stays. I've just joined.
Okay, welcome, ma'am. I would again introduce you to all our participants. She is Dr. Gayatri Singh. She is a professional in the field of public health nutrition and holds a PhD degree in nutrition. She is currently working with UNICEF as a child development specialist, New Delhi. In UNICEF, she leads the work on infant and young child feeding. She has worked extensively with the national and state governments, academic institutions, and with NGO partners in designing, implementing, and managing large-scale programs for early childhood development and nutrition. Today, she will talk about initiatives taken up by UNICEF India to promote and protect and support breastfeeding during COVID-19. Over to you, Dr. Gayatri. Now, please stick to the time limit of 10 minutes. I request all the panelists to please mute your mics. I am muting mine, except for Dr. Gayatri. Over to you, ma'am.
Abhilasha, can you share the PowerPoint, please?
Sure, I can do that, ma'am.
Good afternoon, everybody, and my apologies because of the bad network connection. I probably missed out most of the presentations. But what my presentation is highlighting is how the technical guidelines were translated into action at the field level. Abhilasha, will it be possible to do it as a slideshow, please? Yeah, thank you so much. The next slide. Starting from if you look at the status of breastfeeding, it's really half of children wait too long for breastfeeding, and nearly half of them are not exclusively breastfed. So even when you're looking at the pre-COVID situation, is that there was a lot more that needed to be done for breastfeeding, and it was very evident that COVID is going to impact on the way these young children are fed. Next one, please. What was required? I think what was important is how do we translate the guidelines which came in very quite early from WHO and UNICEF into action so that it has the intended impact. What was important for us is to reach this information based on the technical science that it is safe to breastfeed for a mother who is suspected or has COVID. This information was needed to be reached to the frontline functionaries because they are the ones who have the interface with the care providers. It was also important to allay the fears. I think when we talk about breastfeeding, we are primarily thinking of pregnancy, newborns, but it is also, you have to look at the entire breastfeeding period. So it was also the elders in the family were preventing mothers from breastfeeding even if they had older children for the fear that they had exposure and they might be transmitting COVID to the children. So it was really layers of the frontline functionaries, the caregivers and elders in the family, and also supporting the mothers to safely breastfeed, observing a few precautions. Looking at the situation, because it was a very unique situation, there was lockdown, there was restriction in movement, Anganwadi centers had closed. So we needed to rethink how do we reach messages and counseling to the caregivers. So it was really looking at all views of all possible channels. Simultaneously, because of this belief that people need food, yes, there were people, migrants and vulnerable population who needed to be provided foods. So breast milk substitutes were also being part of the food basket. So it was important to protect from the influence, commercial influence to breastfeeding. Next one, please. What approach was adopted? I think it was very clear that the information, because it was a new virus, the information was evolving. So it was pragmatic that you start with what you know and use that knowledge into action. So that's what we did. When we say we, it is WHO, UNICEF, and all the other partners, looking at what the technical guidelines are saying and how do we contextualize and repack this information for different stakeholders. To have multiplier effect and to amplify, it was important for all the partners to come together and agree on common set of messages, including common toolkits and orientation packages. So we worked with all the partners, both government, non-government, and the other development partners. Whatever opportunity was there, it was important to reach messages, including for breastfeeding. So if there was orientations happening on risk communication for COVID, breastfeeding messages did get included there. If there were other say orientations or training using the virtual platforms that were happening, it was efforts were made that these messages also get integrated into the training. What was unique, I think, and it's important to mention this, is the frontline functionaries did have knowledge about breastfeeding. So that was an advantage. You were not starting from a clean slate. So what they needed was what more needs to be known, what is the current information, how do we convince families that it's safe to breastfeed, and lot of innovations on how to reach the families came from the frontline functionaries. So the Anganwadi workers, what they did was they made WhatsApp group for the mothers based on the age of the child. And that's how they started reaching WhatsApp messages. So looking at whatever was available, created their own messages, and at the same time using infographics and the small videos, interactive videos, it was the messages were being reached to the caregivers. At the same time, it was important to garner support from the larger community. So in some states, they reached out to the PRIs and also to the members of the self-help groups. So that it became an agenda for many more people. Next one, please. If I talk about these are the key initiatives, I've already mentioned but let me highlight on the fifth point, which is talking about we needed to see what was available. So the frontline functionaries, though the Anganwadi centers had closed down and are still closed down, what was happening is field visits. So the frontline functionaries were visiting the fields either for surveillance, contact tracing, getting information, or for provision of take-home ration, because that service after a little while continued. So when they were making contact with the households, so key messages were also being delivered through the household visits. And now as the unlocking is happening and services are being restored, so the opportunities available like the village health and nutrition days were also used for communicating messages. In states like Gujarat, where they have every weekly gram sack, that means a communication at the village level, breastfeeding and other nutrition messages also found a place. So that is what was important. At the same time, very quickly, even at the health facility level, bedside counseling started happening for the caregivers. And there was a need. I think it was very important, and BP and I played an important role in tracking the violations and seeing how the breast milk substitutes were being promoted. And quickly, there was an increased demand from the state for orientation on the IMS Act, and also guidance was issued for food businesses, NGO partners, that what are the healthy and the safe foods and why breast milk substitute should not be accepted. Next one, please. Looking back is, I mean, though I'm saying gains, but like where we are, we do have standard toolkits. The frontline functionaries are better equipped in terms of information as well as key tools that are available. And continuity of communication and counseling is being restored. So all these processes have been set in motions. Now, reflecting on what are the key learnings, next slide. COVID-19 has definitely refocused attention and emphasis on protecting, promoting, and supporting breastfeeding. And this opportunity should be seized to the fullest so that we can work to improve the way the young babies are fed in India. The next one, please. While we are using multiple channels, we are using multiple contacts, there is a new way of communication, but we really still do not know whether the using a telephone or technology-based communication, does it have the same value as face-to-face communication? So it's important that at the same time that we need to assess both the coverage and quality of these messaging. And to do this, a number of states now are inbuilding this in their concurrent monitoring system. So it's still work in progress. Much more needs to be done to see that families assimilate these messages, are able to recall and act on these messages. Thank you.
Much, Dr. Gayatri, for your presentation. We have now the last presentation for this webinar. I would like to invite the panelist, Dr. Arun Gupta. He is a pediatrician, a fellow of Indian Academy of Pediatrics, who chose to give up his lucrative private practice and founded the Breastfeeding Promotion Network of India in 1991. He focuses on policy analysis regarding support to breastfeeding women and child nutrition and conflicts of interest. He writes nationally and internationally, and he is the creator of IBFAN, World Breastfeeding Trends Initiative. He is the convener at Alliance Against Conflict of Interest, that's AKI, and Nutrition Advocacy in Public Interests, that's NAPI. For policy level inputs. Today, he will throw some light on the exploitation of COVID-19 pandemic by the baby food companies. Over to you, Dr. Anu. Your mic is mute, sir.
All right. Thank you so much, Bilasha, and once again, welcome everyone to this. Being the last speaker, I'll try to put my bit here, which is a bit different from the technical side, which is my topic today is exploitation of COVID-19 and how the companies, both food companies and the feeding bottle companies, are capitalizing on the. It's not working. Just give me a second. I don't know why it stopped sharing. I'll just do it again and see if it works.
I would request rest of our panelists to please mute the mics, please.
Yeah. Can you see the next slide? Is it okay? Hello?
Not see your screen, sir.
Can you see or not?
No, sir.
No. All right. I'll try again. Now? Can you see now?
Yes, sir. Yes, sir.
All right. So we are actually experiencing a lot of capitalizing on COVID-19, which actually is a blatant violation of the existing law called IMS Act. And I'll share with you examples of how we call it manipulation by association with the health system. So I'll share with examples of free distribution of milk, powders, or formula, or foods for young children even, spreading misinformation to public, sponsoring doctors and their associations, even during adult nutrition, and how feeding bottle companies are also not leaving it behind. I give credit for sharing, to all the vigilant friends from all over India for sharing these examples with us. And I have tried to compile them all to bring it here. Now, first of all, I'll bring to you the sharing of the foods which are being distributed, were distributed freely, may be happening now, but this is what we heard in early part of the COVID epidemic. Where you see here in the first slide, you see there is a connivance between the NGOs. Nestle had joined hands with the NGOs, police, and administration. Now, those who are the protectors of the law, here they join Nestle in giving out free formula, which is actually against the law. So you will see here young mothers with very young babies, a few months old, and happily getting this whole bunch of lactogen full of table. And I'll show you examples from different parts of the country. Here you see an IAS officer in Chandigarh handing over a tin of Cerelac, which is a cereal food, to again, you know, look at the baby, again looks a few months old, maybe 8 months or 9 months old. And he proudly shared it on his Twitter. You know, the one side is that this whole system also provides an opportunity called a photo op for everyone to showcase that we are doing good for the community. At the same time, I do not think they realize the damage they are doing by propagating this stuff. Now go to Jharkhand. We received this, that there is another NGO, you know, and distributing this stuff. The bad part is when you even write to them, they don't respond. They do put it on Twitter, but they don't respond. Go to West Bengal, where you see Jalpaiguri. Again, you see the armed police and again a foundation there, you know, which I hear that this is belongs to very highly influential people. So these are the examples of free distribution. Now I come to other examples of how Nestle continues to exploit. So you might have heard about Nestle Nutrition Institute. Always Nestle hides behind it. So Nestle is hiding it and offering trusted partnership. That's an important thing to know. So that's how the partnerships are invited, and we get into these partners. Here, this is about, in the next slide, if you see, the product is Nan-Grow here, mentioned for 2 to 5 years old children. But today I was a bit interesting. I found, I just put you know, what is the definition of a toddler? This product is promoted for the toddlers. And I found an Oxford dictionary saying a child who is just, which is around 1 year. So this is how I would say a confusion. The companies are very, very good at causing to the parents. And I am very disappointed. The governments always look the other way. So that's the point which the government has to take note of, that how this is going on. Nestle again, here it's more of the adult nutrition part, and they catch hold of the few doctors, which I call it manipulation by association. And see where the Nestle here. All these examples are coming from early May or June. So this is important. Now, Amul, they don't want to be left behind. So in April, we found a young girl holding this Amul spray infant formula in her hand with a deer on its top on the label to increase its sellability, no doubt. But the point here is we were not able to trace how it reached her, but it definitely reached her during this epidemic. Now, this is what bothers me from the point of view of being a health worker myself, and you know how we continue to find this for the last 30 years, and this is now increasing in its speed as well as intensity. The violations which are sponsoring, I have not seen much of FOXY involved earlier, this Obstetrician Federation of Obstetrics and Gynecological Societies of India. Here it's very clear. Look at the Danone sponsoring this FOXY webinar. You will see on 18th of June, this is happening. So it's important to know that, you know, there is a very widespread exploitation going on in the country at this moment. So Danone directly reaches out to mothers through tweets, offering an expert advice where they get hold of the doctor, as Patty showed it earlier, So this doctor is advising, and what we call is spreading misinformation. So I won't go into the detail, but these are the they just want mothers and babies to be away. That's how they sell the breast milk substitutes. So causing confusion in parents' mind is their game. Abbott, another company, now Abbott infiltrating the communities of doctors. This is claimed to be a 380,000 doctors in this web community being sponsored by Abbott, and they continue to cause the seminars on related topics. But companies say, oh, we don't promote formula, but we are not saying you promoted formula there, but we are saying you are sponsoring it, which is a violation of the IMS Act. And in case it is just taken on the face value of an ethics, it is a manipulation by association. Another one, an immunization seminar where the high flying people from Indian Academy of Pediatrics are the speakers. Abbott is a sponsor again. Again, Abbott connecting again with some influential pediatricians. It's a webcast again on happening in couple of days from now, 18th. Now I'm coming to Medela. Medela's now a feeding bottle company offering feeding bottles on discount at the Amazon is a very clear and blatant violation. They don't want to leave themselves behind when it comes to sponsorship also. So getting onto the influencers, they get into these influencers who are now projecting as lactation counselors. So Medela is very active in this. So I'm coming to my last slide. What do we learn from here and what can we do about it? So we now clearly understand the widespread exploitation is evident of COVID-19. It does attract provisions of IMS Act, the Infant Milk Substitute Act in India, which is 30 years old now. Partnership with health workers continues unabated and brings us to the platform, what we call as conflict of interest. Promotion of breast milk substitute, especially sponsorship, is very, very aggressive. During COVID, it has been happening earlier. Now it's really about 10 times, I would say, in my estimate. Increased sales of BMS and consumption. This is what we call as commercial determinant. So this marketing is commercial determinant of health for our babies, and we don't even monitor them. How many of them died during this marketing? Civil society vigilance is helping. So that's what we are again bringing back my thanks to the civil society, to the people who are vigilant all over the country, even though we are few, but we are making a difference in letting it know. Finally, a couple of things I would offer as my recommendation and advice to all the professionals and the association. You should follow legal and ethical principles which we stand for, or you stand the test of scrutiny. So don't get upset if you are being scrutinized, because it's a law. It's a question of law also in the country. If you don't believe in ethics, then I would urge all the professionals, health professionals here today, which are here, they convey to their bodies, associations, that this is wrong and we should try and prevent it. And I'll also request the governments, if they are attending, and if they're not attending, then they could reach out to their governments in the states and the center, telling them, do not look the other way. This is serious. Babies are dying because of unnecessary and aggressive marketing. So that brings me to the last slide. I can't help sharing this quote from Dr. Magdalena Vulu. She works in Timor-Leste now. And I love this. She says, know this, dear health authority officials, health professionals, academics, and scientists, know this, all your legitimacy, credibility, and your professional reputation is gone as soon as you take money from bottle or formula. It is that simple. There is no debate. You're truly Dr. Magdalena. Thank you so much, friends. And I once again request all the friends to be vigilant, report to your governments, And if somebody from the industry is also listening, I will say, shame on you, industry. Thank you very much, everybody. If you have any questions, kindly write in the Q&A. We'll be very happy to answer.
Thank you very much, Dr. Arun, for this informative and eye-opening presentation. Before we go ahead with the questions, I would like to thank all the panelists for their presentations today. We have received a lot of questions, and I would request now Dr. J.P. Dadich to moderate the question and answer session. Over to you, sir.
Okay. Thank you, Abhilasha. Before I go for question and answer, I have just jotted down a few summary points, and let me summarize the discussion based on all the 6 presentations today. Things which have come out very strongly are that mothers with suspected or confirmed COVID-19, they should be advised to practice standard infant and young child feeding recommendations. And it's very important to emphasize it here that the standard IYCF recommendations, namely initiation within 1 hour of birth, exclusive breastfeeding for 6 months, continued breastfeeding for 2 years or beyond, along with appropriate complementary feeding. So there should not be any confusion about that. Then the second point which has come out very well is mother and baby should not be separated unless any one of them is sick and require care in ICU. So that should be very clear, because a lot of questions from the audience also came about this, whether they should be separated or not. Then third point is we know that the virus is not present in breast milk as of the research which is available today, but risk of COVID infection from the mother to the baby is there through respiratory droplets. So mothers should practice adequate IPC measures and those measures which we discussed in our presentations. The fourth point which came out was that the violation of the IMS Act, and I'm talking about in context of India, the IMS Act and exploitation of the COVID pandemic by the baby food companies by various means should be strictly dealt with. They should be reported and appropriate action should be taken. Then the fifth was, since new research is emerging every day, the guidelines on infant and young child feeding in COVID-19 should be regularly updated, and that should be conveyed to the care providers and mothers and families regularly. Then sixth point was that a lot of efforts are happening at ground level to support mothers through counseling, giving advice, giving practical help, but more is required. I mean, the coverage, the geographical coverage, and other things. The more is required to be done on this count. Then the seventh point, which was there, that, and it's a kind of recommendation may go from this forum, that the government agencies, WHO, UNICEF, civil society organizations like BPNI and other care providers, they should come together for having a kind of consensus guideline in the context of our country, develop some standard operating procedures, SOPs, information tools, and awareness, and then have awareness generation efforts so that the information can be disseminated to the right people. This is like, I mean, and I like this when probably Dr. Gayatri told this, that this is a challenge, but we should convert it into an opportunity. So these were summary points which I could jot down. There were many more, but in the interest of time, I think I will stop here. Then there were a few questions. Some of the questions we've already answered in the question and answer list, but there were a few questions which I have picked up. The first question is to Dr. Kheda sir, for you. And this question says, webinars by Danone, Nestle, and others, they are happening regularly in the context of COVID-19 and breastfeeding. They are not necessarily on this topic, but on other topics also. Can some action be taken by government at national level on this? This question was specifically written for you, sir. Dr. Kheda, please. Your mic is muted, sir.
At this point of time, because I am in this stage of transition, I am not holding any official position. But because I have been working in the government system for last so many years, if these, violations are, because as per the available information, I mean, the conferences, particularly the medical conferences by these baby food companies are to be discouraged, whether they refer to the matter of child feeding or whether they are discussion on with the cardiologist. But as a matter of principle, medical conferences are not permitted. And I think webinar is nothing new. Webinar is an extension of, it is another mechanism of doing a conference. So I think, the people like us, maybe BP and I, should write to the government saying that, we must discourage, this kind of a practice. At least the medical conferences being organized, because this, kind of a directly or indirectly promotion of the baby, infant milk substitute, which is very harmful to the health of the children in particular, and which can really impact breastfeeding. I think we must write back to the government informing about these things.
Thank you, Dr. Kheda. Next question is to you, Dr. Arun. And the question is how to counter the industry when they are playing with words like having a definition of toddler. You mentioned in your presentation.
Definition of, sorry?
Toddler.
I don't know how to handle it, but I think we can write a technical note on this and write to the ministry for labeling and using the confusing thing. So since it struck my mind this morning only, and I checked the dictionary definition, and this is one of the strategy which company is using, and there are strategies which they use for ages, but this is one thing which was very, very important to be tackled. But at local level, anybody who is asking this question or other people who want to tackle it, they should challenge the company. When the company introduces such products to them, the company should be challenged with this argument. And why not? The question is, why not IMS Act is applied to NAN-GROW? That's the question. So I hope that answers. If still I'm not clear, I would encourage you to ask me again. We can even answer questions later on. For those who are not able to get answers today, we will get back to them with emails. Thank you.
Yeah, this question was written by one of the participants. So if he is not satisfied, he needs more information on this, then he can write to us by email and we can have a discussion on emails. So I come to Patty, to you now. There were a lot of questions by the participants about risk of transmission of the virus through breast milk, breastfeeding. And but we know that breastfeeding also protects the baby for many other infections. But now some information is also coming about presence of protective antibodies against COVID-19 in the breast milk. Do you have some more information about efforts being made, some research being undertaken about this, the presence of specific antibodies against COVID-19 in breast milk. Would you like to share something about this?
Yes, thanks very much. Yes, there's been quite a lot of work going on. Again, we come back to the trust issue of who is doing what and why. And that's why I flagged up the Gates Foundation funded thing on a breast milk substitute. And they're also looking at, well, is the virus in the breast milk? So when you have a multiple Gates is not a benign funder. I mean, we can see that they do a lot of work in terms of single issues, polio or whatever. But in terms of infant feeding, it's a very much a mixed bag. And those of us who work very closely on this issue about global governance are very concerned about the predominance of private sector money on the UN particularly. And there, I see in the question, there are lots of those type of questions about, well, what's it going on? And of course, we all know in the media, the WHO is completely in the firing line of with the US, pull out its money, and then what? Where is the money going to come from? So I'm raising that because in terms of research, you've got these division between people looking at the breast milk and saying, well, if we find the virus in it, that's it. You know, then we must go for the formula as an opportunity. And I think that is starting to show very much more clearly. There are those who are working, like there's a fantastic researcher, Natalie Schenker, who's doing milk banks research and looking, and she's coming up with incredible things about, I think it was 80% of the samples were, and I don't want to be inaccurate because I'm not a scientist, but we're showing really good antibodies in the breast milk, and that the babies that were actually getting sick, if they did get sick, did better if they were breastfed. So I don't know. I don't want to. A lot of this is not published yet. You know that, JP, that, you know, the peer review, there's no time. And so if one says something too much, you're almost pushing things that we shouldn't perhaps push. And I want to be careful about that. And I know that all the scientists that I trust feel the same. But we feel terrified that people will concentrate on the virus being in breast milk, or bits of the virus. And so I'm really impressed that WHO, despite its conflict of interest, and there are questions there, and we, IBFAN, have been at the forefront with other NGOs to say WHO should have public money from states, you know, in order to be able to carry out its good work. And that we come back again to trust. Who do you trust? And basically the companies are coming in there to try and say, we're the ones that we can trust. And they'll use all Abbott is absolutely key in the US position on cures for COVID. So they're going to be positioning themselves quite strongly with governments as the partners you can trust. And so we must go back to that thing. Governance, please. We need states looking after human being and civil society and real human beings, and not confusing and getting them in. So I don't know whether that's answered, but it is complicated, but I think we can be confident that breast milk will always provide much safer way of feeding a baby. There's so many things, as you've shown. Thanks.
Thank you, Patty. Thank you. Next, I go to Dr. Gayatri. Dr. Gayatri, you shared a lot of things which are happening in the states and at district level and at ground level to support the mothers to practice breastfeeding during these difficult times. Would you like to tell us something about which you think should have been happening, but it's not happening actually? Is there anything which should be happening? I mean, what we can do about that?
Okay, what I said was the frontline functionaries are undertaking visits. The village health and nutrition days are happening, but what we really do not know is how the messages are being delivered, what messages are being delivered, and how are these being received, and to what extent. I think it's looking at this, it's a very strange situation. We do not have the data, so it's a step in the right direction, but we do not have data in terms of coverage and quality. What is also one the issue which is being flagged is like frontline functionaries who themselves have breastfeeding mothers, and when they go out for working, so when they come back to their own homes, so there's a discrimination and stigma and the fear that they would be transferring the infection to the child. So when we're looking at this whole issue of breastfeeding, we probably need to look at the entire spectrum for the breastfeeding period. We do not know what is happening at the facility level, because the information that we have is because of what is available through our partners who are working very intensively. So there is much more which is needed to be known. Are these sporadic examples, or are they really happening at scale?
Okay. Yeah. Thank you, Dr. Gayatri. And now a question for you, Dr. Padmini Angela De Silva. Dr. De Silva, since you are in the regional office of WHO CRO, can you suggest something? I mean, there are 11 countries in our WHO CRO region. How these countries, they can benefit from each other, from their experiences, sharing their good practices and all those things. Can you say something about that?
Yes. So one of the very innovative approaches that WHO CRO is taking is something called South-to-South cooperation, which is sharing of good practices, study visits, and so on between the different countries of the region. To be honest, during this last COVID epidemic, we really have not had much time to share too many practices and so on with countries, especially with regard to infant feeding. But this is a very good suggestion which we can take up in the form of maybe case start. I could also discuss with my UNICEF colleagues and see for how we can address this. One thing that I would like to also flag is this whole issue of digital marketing of breast milk substitutes, the various ways in which digital marketing occurs. This is a kind of a fairly new phenomenon in the last maybe 8 to 10 years, and our code legislation in countries, the original code is probably not equipped to deal with this, because there are lots of ambiguities and clarities about these webinars and Twitter messages, especially from private individuals who are obviously co-opted by companies, but the kind of message is one stop that. So this whole issue of digital marketing I find very concerning, and this is one of the areas that WHO is working on. In fact, it was also raised at global level and at country level, at regional level. At the moment, we are just trying to, because there is not much evidence of this as well. And if I may just add one line for the conflict of interest, because I saw a lot of questions about the conflict of interest of WHO. So the bottom line, I cannot comment on individual, people or messages that are there. But I don't think anyone doubts the WHO's commitment to infant feeding in the types of guidelines, the enforcement of the code, the mechanisms that we do, and all the work that we do. So, and at a individual level or at a departmental level, whatever interactions are guided by the framework of engagement of non-state actors. Now, I know that there are some, issues with that, but as WHO, we do our best to try and ensure that our focus and our priority is health of people rather than any, other private agenda of sorts. Thank you.
Thank you, Dr. De Silva, and thank you also for clarifying the issue about conflict of interest. So this was about summarizing the points and then question and answer. So, Abhilasha, back to you now for further proceedings.
Dr. JP, for this Q&A session. It was very interesting. I am... yes, sir.
Can I just announce a good news that a doctor from the participants has announced that they have cancelled one webinar supported by Denon coming from Foxy.
That's a victory. That's a victory, I would say, right in front of us. Congratulations to all of us. Congratulations to BP and I for this. As I was saying, thank you, Dr. JP, for this Q&A session and the concluding note. To all the participants and attendees whose queries could not be answered during the webinar, you can write us an email at bpni.india@gmail.com and we shall get back to you with the answers. To all the participants, we had launched an infographics. You can we are sharing the link to these posters and infographics in the chat section. You can also download it from our website, that's www.bpni.org, and use it for counseling mothers and spread the word. Lastly, I would like to extend my sincere appreciation to all the panelists for their time and knowledge sharing. They have presented such insightful information. My thanks and appreciation to all the attendees who gave their valuable time to this webinar. I would congratulate our BPNI team who has done a wonderful work. Each one has put in making this webinar a success. The backend support is of great significance in online webinars. Thank you, Yashika, for providing that. I hope you're hearing us. All of you can keep tuned to our website, www.bpni.org, for our upcoming webinars. It was a pleasure having you all here. Stay safe. Thank you.
Thank you. Thank you very much.
Thank you very much.
Thank you, everybody. Thank you, all the panelists and everybody who came in with his time or her time. Thanks again.
Thank you, everybody.
Thank you. It was very interesting and useful.
Thank you very much.
Bye-bye.